implementation of this pandemic, although a global pandemic, were coming predominantly from places of privilege in the global north. And as an international collective, as part of the Sustainable Futures in Africa network, we wanted to create opportunity and space to address that imbalance. It's a typical imbalance that we see time and time again across issues and contexts across the world over time. And this project is a small contribution to try and address that imbalance by looking at marginalized spaces and voices, at plural perspectives and experiences and responses to the pandemic, in order to resource our network and our partners and our stakeholders to better respond and better move forward and evolve from this pandemic time. So today, this afternoon, we have a short time with you. I'm going to give you a little bit of a rundown of what's going to happen. We're going to start with a very important, for all of us, including my panelists, a launch of the Whose Crisis website. And this website is going to become, starting today, a very, very important place for our project. It's going to become a hub and a platform for many of those perspectives and experiences and responses across our communities of practice in Sub-Saharan Africa. It's going to become the platform where we get to showcase and engage with different types of communities and publics around those experiences. Alistair Curry from Multiply By, and a key partner in this project, is going to give us a quick guided tour of that website. And then we're going to do a short panel discussion with some of my esteemed colleagues here today. We have a range of people from across our team, including Professor Joe Sharp from the University of St Andrews, Dr. Deepa Pulanikatil, from the co-director of the SFA network based in Eswatini, Mr. Bosco Chikonda from the Arts and Global Health Center in Africa, Dr. Vincent Muanika from Makerere University in Uganda, Professor Shola Ajayi from the Technical University in Nigeria, Professor Rebecca Lekoko from the University of Botswana, Dr. Sizwe Mambaso from the University of Eswatini, and Mr. Russell Dlamini from the National Disaster Management Agency in Eswatini. We will also have other colleagues, important colleagues that may be sitting with these panelists in offices as we speak. So as other voices come into my panel discussion, I will make sure to introduce you. So please forgive me if you haven't heard your name yet. I will make sure that the introductions are completed before we conclude. I will encourage you from now, please, to jump into the chat and let us know who you are, where you're situated, and what sort of professional or vocational background you come from. Also to use the chat bar to ask questions or make comments in response to anything you see and hear today. And finally, we will run a couple of polls. I think about 4 polls throughout this session, starting anytime now, Alistair. So keep an eye on poll questions on your Zoom interface. So with that, I hope I've remembered everything, but I'm sure somebody will tell me if I've forgotten. I will hand over to Alistair.
Thank you very much, Mia. I've got to say this is a very surreal experience for me, because I'm seeing myself in one camera here, I can hear myself over here, and as you're about to see on the launch of this website, we're going to see ourselves as a webinar on the website as it launches. My name's Alistair Curry. I'm the head of a creative agency based in Glasgow, Scotland. My role within this network is to support the entire network with creative content, but more importantly, in my mind, a knowledge transfer as well, so that we can enable the network to be able to tell their stories and get me out of the way, so that the stories are told as honestly and as unfiltered as it's possible to do. And that's what this website's about. We've created a media platform where we have the opportunity to amplify the voices of the underrepresented and the underserved communities as it pertains to the Whose Crisis, the coronavirus pandemic. It's often said that history is written by the winners, but I think in this social media age, it's more accurate potentially to talk about history being written by those content producers and those with the technology. And this is what this website hopefully seeks to do, is to give content producers in the Global South and the communities that they inhabit the opportunity to tell their stories with as little filter as possible. And it's our job to make sure that we can get those messages to the policymakers in a very truthful and honest fashion. The homepage sets out a very simple intent and is largely curated selection of creative content. But over time, as this populates, hopefully what you'll see is a website that you can search for content based on whether it's theatre, music, poetry, video, the medium that it's presented in, but also based on topics such as health, education, social sciences, and the like. So with no further ado, and undoubtedly with no shortage of technical difficulties, I am going to attempt to show you this website. You just bear with me. So this is your website, and what you will notice is that it is coming soon. So I don't have any confetti cannons, but if I refresh, what we should find is the site is now live. So this is the website. As I say, it's very, very simple. Thank you very much. I can see notable applauses from the panelists. We have content here, a video that we created, the Together video, which is quite successful over social media, and a curated list of content of work that was spontaneously offered and given voluntarily in the aftermath of COVID spreading throughout the world. As I say, over time, we will be able to curate this information, collate it in our Explore section, where you'll be able to filter by content. We can get some information about the organisation itself for those who are interested, whether that's to do with the project itself, the research activities, our funders, project milestones and the like. But then also we've got the opportunity to host events live as we're doing here. And indeed, to that end, we actually do have a live page already up and running. And this is where it will get a little bit meta, as we can see myself within the website. The project itself, the research activities, all very confusing. Our funders, a little bit of an infinite mirror project milestone. But that should give you an idea. And we now have the website up and running. You can get it at whoscrisis.org. And I'd encourage you on this page, on this live page, there's an opportunity to add comments, leave your name and email address for verification. But we'd love to hear your thoughts on the website. We'd love to hear your comments on the webinar, whether this is something that you would want to see more of, and any potential feedback that you think would be useful. So with that introduction to the website in place, I'm going to hand back to Mia. Give me 2 seconds to find that again.
Thank you very much, Alistair. That's very exciting. So I'm hoping that somebody can post that web link up to the chat bar for people to browse at in their own time. And also to note, possibly to, I think via that link, people can now join this session or catch up with it after the fact. So it would be great if people could begin our long journey of trying to promote attention and visiting to this site, where we're hoping to use the site itself as a place of engagement across the world, as well as a place to curate the experiences of others who are less heard. So I'm going to take the next 30 to 35 minutes to hear from our panelists about a couple of key factors that we are working with at the moment in the Whose Crisis project. And I'm going to ask about 2 questions, and then I'm going to refer to the Q&A tab or the chat tab. So if anybody from our audience today would like to add questions or comments, I'll keep an eye there and also relay the questions that I can as we go along. So my first question to start us off to the panelists, thank you again for being here, is to ask you if you could select some of the key or critical cultural, social, or economic issues that you have witnessed that have emerged since the beginning of the pandemic in the context of the communities within which you work. So in the context of this session, you can actually just pick a couple to highlight. You can focus on the social or the cultural or the economic. You don't have to cover all of them. You can talk about one specific community, or you can characterize a few communities. As I said in the introductions, we're working across many, many different contexts. So we'll understand that what we get today is a plurality of perspectives. So that's the first question. If you could just highlight some of the issues that have emerged that are beyond the physical health issues and because of it, that you have seen emerging in your contexts since the pandemic. And I'll turn to Bosco to start with, please.
Right. Thank you, Mia. Am I audible enough?
You are perfect.
All right. No, thank you very much. So my name is Bosco. As Mia rightfully introduced me, I'm from Malawi. I think one key observation that we've seen here, especially here in Malawi, being one of the developing countries, has a lot to do with issues to do with migration and how the COVID situation has affected us. So for Malawi, to give it a little bit of background and context, we have a lot of people migrating out to nearby countries, especially South Africa, in search of better lives and stuff like that. And that has been quite helpful for the rural areas, especially where we've observed these situations happening. And people have benefited from the remittances that have come from these individual members of their societies. But with the coming of the pandemic, Malawi never had an actual lockdown like many other places or countries actually had. For us here, we just had a few measures and rules that were being implemented, but of course, enforcement was also a problem. But relating to the issue of migration and its effects on the rural communities, our nearby South Africa had different phases of lockdowns, and we have had a lot of members of our rural communities being sent back or actually opting to come back to Malawi because the situation there, they were part of the informal sector and there was nothing much for them to do again. And coming back home, you'd find their integration has been quite difficult and challenging. They're finding it difficult to earn a living because they left, and also they're coming back to a situation where they're living in abject poverty, and also communities looking at them and perceiving them, say, okay, you're coming back from South Africa, where we're hearing the pandemic has hit hard. What have you come back with? So normally we'd expect somebody when they're coming back from South Africa or any other nearby countries where they migrated to be coming back with some source of income and stuff like that. But the situation has been different this time. We've had thousands of people returning home, but with no remittance, with nowhere to start from, and facing a lot of stigma and discrimination from the locals. So that's one thing that I can actually say, it's been quite challenging, especially for those migrants and many other people that have been affected in that way. I think I should stop there for now.
Thanks, you, Bosco. That's a great start. Thank you. Can I turn to Professor Lekoko to add from your perspective in Botswana? If we have audio. Okay. Oh,
sorry.
Hello.
Sorry, Mia. I forgot to unmute. Okay, from Botswana. Can you hear properly?
We can hear you with an echo, and we can only see the top of your head. So if you could go, I don't know, if you could tilt your screen down, or now we can see you perfectly. Oh, now we can see you. That's great.
Okay.
That's perfect.
Is that okay now?
Yes.
Thank you so much. From the perspective of Botswana,
Hi,
that
Rebecca.
echo.
Hi, Rebecca. Can I ask that you turn off any audio that's playing on your computer? Because that's what's causing the feedback loop.
Any audio there is.
Okay, let's Alistair, perhaps if you work with Rebecca on the chat, and we'll come back to you, Rebecca.
Can you hear now?
Yes, actually that's quite good. Go for it.
Is it okay now?
Yes.
Oh,
Perfect.
thank you so much. Thank you so much, Mia. Sorry for that confusion.
No
I
problem.
guess from the perspective of Botswana, for example, let me just start by saying, just like everyone else everywhere, when this pandemic came, I think first of all, there was that fear of what is going to happen to people, to the lives of people. Then what happened when we started? There was a lot of cooperation with the policymakers in terms of what should be done and what should not be done. But what happened was, as we are going on, the issue of communication and messaging became a problem in terms of, first of all, how did the policymakers communicate COVID-19 to be able to be understood even by the ordinary person? So starting from there, we started having some problems in relation to the issue of credible information being passed on, and then the issue of especially one zone, the city being more affected than other places. And therefore, the issue of people even fearing to come to the city. So there was this division between the rural and the urban places. Up to now, we still have that division whereby people feel like urban places are unsafe while rural places are better. And the issue of credible information reaching especially the rural people is still an issue in Botswana. And a number of social issues, especially pertaining to the issue of how safe people are, for example, in the public places, in the public transport, how safe especially people who are disabled are when they walk around. Those are the issues that we are facing right now that should be addressed when we talk about this pandemic. Really, there's still a lot of confusion as what exactly it is. Who is it affecting? Who should be responding to what is happening in Botswana? But like I'm saying, a great division between the urban and the rural area. I think that's what I can say so far.
Thank you very much, Professor Lakoko. That's really helpful. I'm going to turn to Mr. Russell Dlamini next.
Thank you, and good afternoon to all, and good morning maybe to some of you. I felt it's very important for me to answer on this question. I suppose I heard it, I heard you very well. Two major occurrences that we have experienced due to COVID-19. In Swaziland, we did have a partial lockdown. We were actually pushing for a full lockdown, but we couldn't, basically because of the nature of Swaziland, that mostly for most items we were dependent externally, and that our country is almost intertwined with South Africa. But the highest impact we've had, first of all, that is unreversible, is on gender violence in the country. Well, we've seen families, we've seen a significant hike in the number of gender violence cases, gender-based violence cases that have been reported. But also, and the worst thing is that we've seen a high number of children falling pregnant, you know. And so as we began to open schools, some girls actually dropped out of school because they had fallen pregnant. And this is a huge number. And to think about that right now, I mean, to put that into perspective, we've not opened all classes, we've only opened completing classes. but the number is significant. It's actually more than 10% of the completing classes. So we are actually now looking at the extent of the impact as we're about to open, the rest of the classes. And then secondly, I mean, the biggest one as well is the loss of income. Loss of income due to loss of livelihood, not necessarily employment. Yes, some people were temporarily laid off, and those who were temporarily laid off, we were able to pay, them a minimum income so that they can just buy food. But there are those who were selling items, who were crossing the border to buy in South Africa and coming to sell locally, and also selling locally and going to buy in South Africa. I mean, buying locally to go and sell in South Africa. And all those have lost income since the beginning of, and this period has lasted now for almost 8 months. So some people have been without income for 8 months. And lastly, it's the impact of food distribution or food aid that we have. So people have really been idle and just dependent on government on giving them money for food. I think those are the two major items that I wanted to bring to you.
Thank you so much, Russell. I'd like to turn to Deepa next, partly because Deepa bridges academic and non-academic sectors, but also Eswatini and Malawi contexts. And I wonder if you could specifically build a little bit on the gender-based issues that you've experienced in both contexts, Deepa.
Okay, thank you. As Russell rightly said, there has been a rise in teenage pregnancies, and in Malawi we work with one village in Machinga district where we follow a group of school children in the secondary school very closely, and we found that in the highest class out of 23 girls, 15 of them got pregnant just during that COVID period. So this is really a high number. It is shocking. It is, we cannot ignore that. Similarly, we've also been reading in the news about the rise in divorce cases in South Africa. And gender-based violence, South Africa, Swaziland, Malawi, we've been hearing that. This is really disturbing. We have to understand why are family members inflicting violence, and why are teenagers making such choices. So the pandemic really has a gender aspect that we have to address, not just now, but also beyond the pandemic, just society as a whole. And if you look at some of the other examples that were given by the panelists, in terms of behavioral aspects, migration, communication, community dynamics, all of this can be better understood with social sciences. So I was really happy to see that we're part of this UK Festival of Social Sciences. So the pandemic is not just about health or statistics or governance, but it needs to, social sciences really will help us understand and unravel all the different issues that people have experienced in the pandemic. But also on a positive note, we have also seen that communities are coming together in the spirit of volunteerism. People have been voluntarily making cloth masks, donating, even in Malawi, in our project as well. In Eswatini, the government set up volunteer committees in all the sectors, and they were, volunteering their time day and night, weekends, to develop proposals for the economic recovery post COVID-19. So this spirit of togetherness, selflessness, volunteerism, caring for one another, working together, checking up on friends. These are these higher values of human beings which came up as part of this pandemic. And so I take with me the biggest lesson that we need to nurture these values. And I would use the spirit of Ubuntu. Because we have this common humanity, we're all so connected. I think that is what is most precious that we can take back from this. It took us a pandemic to come together like this. So although we have so many negative issues, we also have a lot of positives that came from this pandemic. Let me stop there. Thank you.
Thank you, Deepa. Thank you. And I'd like to also turn to Vincent, Dr. Morinike in Uganda. If you could comment on the Ugandan context in terms of just some of these issues that have emerged.
Thank you very much, Mia. I'm Vincent, of course, based in Uganda. And for Uganda, I hope you all know that Uganda is one of the poorest countries. And we really depend very much on social networks for survival and for everything. So the first 2 months of the lockdown, everybody obeyed the law and said, I would stay at home. But after 2 months, people said, no, it's better to die of COVID than to die of hunger. People became so desperate. Even in our homes, unlike many places outside Africa, where it is better to stay with your wife and children, here it is very, very difficult to live with your wife and the children when you don't have anything, especially when your husband and your provider, and then you don't have anything to provide for the children. It was very, very bad. So as a result, as colleagues have said, what came out was gender-based violence, and we have stories of people fighting, man and wife fighting. So that was a problem. And the other thing is that it was difficult for people who are gregarious, like us in Uganda, who are gregarious. We are good at living together, sharing social lives and so on. If you keep us apart, then we become so depressed. So issues of mental health come in, issues of deprivation come in, misunderstandings come in. There are a lot of issues about, as colleagues have said, about teenage pregnancies in Uganda. It's a very, very common thing that is taking place, but the extent of which we really don't know. Actually, we don't know the scale of the problem until we go down and investigate how much, which kind of societies have been impacted and how they have been impacted. We are still grousing on the surface with the issues. We need to understand further which kind of people have been affected most by the pandemic. As I wouldn't like to repeat what other colleagues have said, I can understand that actually this is, although we are different, coming from different regions in Africa, we share quite a lot of things like child abuse, gender violence, education, remittances, all these things we share quite common. So the colleagues have mentioned quite a lot about these things. Thank you very much.
Thank you, Vincent. Thank you. Yeah. And thank you for the comments and the questions that are coming in on the chat. Please keep coming. We have one more sort of area of panel discussion that we'd like to move through, and then I'm going to pick up some of the questions. So please keep using the chat if you can bring in additional perspectives or questions to our panelists today. And I'm going to turn to Professor Joe Sharp to comment on this question, but also to lead us into our second area.
Thanks very much, Mia, and it's been fascinating to hear from our colleagues, and of course, as a researcher based in Scotland, and I suppose in some respects stuck in Scotland at the moment, I have a slightly different understanding of what's going on, and in many respects, it's really very frustrating. We're trying to understand how we can support communities, and I guess the most immediate community that we'd be thinking of is the community of researchers, our network, our field researchers, the people we work with in different countries. And of course, we have a duty of care to the people we work with. And so we have to think very carefully about what we do with our projects. And of course, our immediate response to the pandemic back earlier this year was to ask everyone to come back from the field, to protect themselves, to stay at home in the way that our colleagues have just talked about. And so, of course, we feel really quite disengaged from communities beyond that. And it's very difficult for someone like myself to really know what's going on. And that's why I think this project is so important, to hear a more diverse set of voices than I'm used to hearing from my perspective in Scotland. Added to that, for the particular work I'm doing in northern Tanzania, working on a One Health project, is that a number of our partners are involved with healthcare provision. So of course, we don't want to put additional burdens on them when they're involved in supporting other communities through the hospitals, through the healthcare systems. But I was really taken with what Deepa said about some of the positives, about the kind of following with a Ubuntu kind of approach. And I've been really taken by some of the opportunities and possibilities that have emerged through through collaborations and networks such as this. Clearly, we still have issues of internet access and equality in terms of access to data and to the internet. However, it is offering a slightly more level playing field that because we've all gone online, then it allows much more participation from a broader set of people. And one of the things that's kind of happened, I think, in terms of us all being in the middle of this quite unprecedented crisis, I suppose, in some ways, is that there's a bit more flexibility in terms of how we spend our research money. And a number of us from the SFA network were involved in another workshop about a month or so ago, when we were talking about participation with a number of Scottish NGOs and their partners in different parts of Africa. And there was a great deal of positivity because, of course, most of our budgets involve huge amounts of money for international travel, which can really, if we can shift them between budgets, can really help to support communication, to support the provision of technology, airtime and so forth for our partners. So it was leading to more equitable participation. But the thing that I found most interesting and challenging, I suppose, from those discussions was the celebration by some of our partners in various different African countries of a kind of return of autonomy to them, because the Western partners couldn't arrive and initiate projects. And so there had to be more of a reliance on trust of our partners to get on with things themselves. And it was really interesting to hear how empowering that had been for a lot of our partners. I think the key question is how we manage to maintain this greater equity and build upon what we've done as a necessity at the moment that could perhaps become a choice in the future. So a bit of optimism there.
Thank you. We have to take it. We'll take the optimism. So it's a really nice transition because this is the start of a really important project that brings together a lot of people around trying to bring an alternative response to COVID-19 beyond the health response, trying to foreground and make visible some of the perspectives and experiences that haven't been given global audience because people haven't got vlogs and YouTube channels and digital devices and publishers to publish novels and songs. So on that note, we're looking to ourselves and our communities and to you, to each other, to try and understand the gap between the responses so far, between the local and the international policies and governance, between the aid and the responses, the gap between those things and the lived experience of communities. So my second question to the panelists is really, to what extent do you feel that currently our communities are being appropriately served by people like us, by academia, by research, by international development, appropriately served by local or international governance, or appropriately served by economic solutions? So this is a broad question because, again, we're talking to a broad panel, but I wonder if some of you could actually respond to that. And please just let me know if you would particularly like to respond, but in the meantime, I'm going to go back to the Eswatini context and ask Dr. Sizwe Mabaso if you have any responses to that question.
Thank you. Thank you, Mia, and thanks everyone for the contributions thus far. I wouldn't have so much to say in this one. Rather, I hope that Russell would be the one better positioned to add to what I will submit. But I think my response would be more weighted towards the academic sector, where I am kind of more oriented with the dynamics that came into play, and on the political side and the bigger social side, I think Mr. Dlamini will deal with that. As far as I'm concerned, I think the policies as well as the strategies that we kind of put in place as a country have gone a long way in ensuring that our response was appropriate for these communities. Yes, fair enough. At the beginning, everything was just, the waters were just murky. No one knew where we were going or what was going to happen. But thanks to especially the unit organization that Dlamini is heading, that they jumped into the head and put down kind of regulations and as well as strategies that governed and guided a lot of us. And as we did so, then things started normalizing. And from an academic standpoint, I know that at some point we were really, really uncertain what was going on. And some of us were even thinking, does it mean we've lost an academic year, both for schools as well as for the universities? But then again, with time, everyone started, especially, I think one thing that we appreciated as a country was the higher rate of recoveries that we started experiencing. And then everyone started thinking, oh, as long as I follow the regulations, maybe I have a good chance. And then things just started rolling. Not that we are there, but it kind of just gave us opportunities. For example, from a university standpoint, we are not yet fully open, but we've been able to grab the opportunity to go online. But that too has come with its own challenges, together with the opportunities, as Joe highlighted. Not everyone is connected. Not everyone has the connectivity. Not everyone has the gadget to be able to go online and access lectures. So there's all those dynamics, but we are learning and grappling along. I think I'll pass over to Russell, maybe to add, especially on the socio-political side of things. Thank you.
Thank you. Russell, would you like to add in at this point? And unmute yourself. You need to unmute.
Thank you. Can you just clarify the question again?
Yes, so we're just talking about possibly the disconnect between the responses currently in place by local or international governance or aid or academia, the disconnect between those responses and the lived experience of the communities. And we don't necessarily know the answer yet, which is why we're engaging in this nature of this work. But from the work that you're doing so far, if you can speak to that bridge.
Thank you very much. Let me begin with academia. I think initially we had left academia out of even our technical working groups, which are the groups that were actually responsible for planning the response and actually implementing the response. These were technical working groups that were officially put in place by the government and gazetted by the parliament of the country. So in most of these technical working groups, we had left out the academia. But just a couple of months into the response, we saw academia coming in. They actually conducted research, and I think it must have been published by now. I'm not sure, but this was done by the University of Swaziland, the Health Sciences Department, in conjunction with the university in Taiwan. And when they brought these results, it was really exciting because it motivated us, the whole technical working group, the agency, the Deputy Prime Minister, the interministerial committee that was set up to really lead the COVID-19 response, because it had some positive items. First of all, it was that people were confident on the steps that government had taken to manage this pandemic, and that most people already were aware. They have heard the messages that we were sending out there for people to be careful and to implement. So that was, then that told us that the strategies were working. So yeah. But yeah, in the beginning, there was a gap. But in terms of the international community and locally, I think there's one thing that has made it very difficult to coordinate this response. NDMA is a coordinating agency. And so we really coordinate to ensure that we have a multi-sectoral response. And so quite a number of stakeholders are coordinated by my agency. And so some forces internationally were actually driving this to be looked at as a health problem and a health response. This was significant for us because our health systems are not meant to coordinate, to have a multi-sectoral response or coordination at the national level. And in the beginning, there was a push to make this only a health response. But because of the legislation that we had, we were able to put this in place. Now, I'm linking this with international support because some agencies, which unfortunately I would not like to mention, were actually pushing this to be a health response. And even as we speak now, they would really love to work in isolation rather than working with the rest of the team. This was said. And then secondly, it was any information that is generated locally was actually not adhered to. Information needed to be coming from, for example, from Europe, if I may say, for it to be valid. I can make an example if you want, if I may. In a closed meeting of the technical working group, I said, based on the information that we know thus far, on the behavior of the virus and how it is spread, I don't see why we should not just enact regulations that everybody should put on a mask immediately, And this was very early in the response. And to my surprise, everybody, almost everybody, just a few people were supporting me. And I said to them, I want you to record this, that after 3 weeks, when the whole world is saying we should all put masks, you are going to be putting the masks. But if we do it early, this is going to help us. And then lastly, the communities. This was seen as a disease for the rich. First, it was seen that it affects white folks. Secondly, then it was looked as a disease for those who are in the cities. Indeed, it did look like a disease for the elite. If you looked at that, most of the people, because the cities actually are more crowded, than the rural areas. So there was that difference. And so, but when we came in, then we were very sensitive to go to the communities to raise awareness, because when a partial lockdown was introduced, was enforced in the country, instead of people staying in the cities, now they went to the rural areas, our communities, taking the virus from the cities to the rural communities. So those were all the dynamics that we needed to, and so at the peak of the local partial lockdown, we saw an increase in the number of cases from rural areas. Thank you.
Thank you, Russell. Thank you. That's really interesting. Lots for us to work with immediately. I'm going to turn quickly to Vincent in Uganda. You have a response to this same issue, but from a very different context.
Yeah, it is that if the local communities are being served very well, if we are comfortable with it, I think this is a new phenomenon, and we had we have no previous experience on which we can base to say, oh, this is the best way to act. So locally, we are taking in recommendations from outside. They were not homegrown recommendations. So, and some of the recommendations were actually not fit for our circumstances, to the extent that actually people feel that they are not served very well because it's not contextualized. When they say don't move out, they don't even say, if you are pregnant, you can go to a hospital. So you find that the prescriptions that were being given locally, they're not taken into very local specific contexts. That was a problem. But again, we have no good understanding of how effective it should have been, the response that could have been. So we needed, therefore, at this time, to go out and document how effective some of these things, some of the prescriptions, how they affected the people. So that is what I could think about that right now for Uganda, because then it's so varied. It's so varied. You have so many categories of people: the urban people, the rural people, the fairly rich, and then the poor. And then you have everything was put in one basket: sit home and wait. So we have no good understanding of, well, what may have gone wrong. So it's now, right now, the time for us to go out and document and be able to say with the confidence how these responses affected the different groups of people. Thank you.
Thank you, Vincent. Bosco, does this resonate with your perspective in Malawi?
Yes, definitely. And it's a similar situation, I think, where what Vincent is actually alluded to, that some of the measures that we put, I think if you look at it at a governance perspective as well, relating to the needs of the society, there's a little bit of a mismatch between the reality and the measures that we're actually putting. But of course, for Malawi, the situation is a little bit different because we're going through a political transition period. So even with the transition, a lot also responded in the same way. And that some of the measures that were put had responded to the needs of the people. However, one thing though that I would want to highlight on that is if you look at the measures that have been put, there isn't really much concentration on who actually needs what kind of support within the society. Because when we're putting the measures, they are one size fits all for everybody. But the situation is that other people are more vulnerable to the effects of the pandemic than others are. And so if we're going to be looking at it from a governance level, whether it's global or local, we would have to be cautious of that effect and say, okay, if we're going to say we should be all wearing masks, are these masks going to be for free or for sale? And who can afford these masks? We had such debates in the country. And we're thinking of issues to say, okay, social distancing and stuff like that. The practicality for us in Malawi is that if you're going to talk of social distancing, we have health facilities that are congested all the time. How is that going to happen, really? You have markets that are congested and all these things. We have has been mentioned here, is that, are we taking that into consideration and how people are going to be responding to the same? So I think that's why I think the need for having a more social science or a social perspective to whatever we're doing, whether it's at a governance level or anything, is very important and key, by keeping the people that we serve at heart. So I think that's very, very important. Maybe before I go, the other thing that I wanted to mention is that as an effect of the pandemic, one thing that has been greatly affected are the methodologies that we use in trying to deal with different social issues. So the pandemic has resulted in different measures, but at the same time, we have had different social problems already existing that have required different methodologies. Some methodologies had been working before the pandemic, but with the pandemic and the measures we're trying to follow, the methodologies can be implemented in the same way. So it's also an issue of saying, okay, so what do we do now? What are the alternatives that we can actually follow that would actually be working to deal with the different social problems and social issues that we have as a country? So even when we're thinking of the measures that we should be following with the pandemic, those kinds of things should also come to our minds. Yeah.
Thank you, Bosco. That's really powerful. So again, from a very, very different context, yet again, for those of you who know our network, Dr. Rebecca Lekoko, are you with us? Does this resonate with Botswana, or is it completely?
Yes. I guess I just want to say a little bit about how the message started. Mm-hmm. Because when this pandemic came, I think we relied more on the health issues. It was all about protection. It was all about safety. It was all about taking care of yourself, washing your hands. And then the social aspect was completely forgotten. For example, what is the impact, for example, of now staying with your children the whole day at home, or staying with the whole family at home? As we have said, gender violence now became more than before, negligence, pregnancy, and all those things. So the social aspect of it was completely eroded and forgotten. The other thing is that for us here, those heroes which were sang, it was all about TV, about academia, who have developed masks, who have developed sanitizers, who have developed, and no one ever thought about the cultural aspect, the emotional aspect, and all these other things. So much that by the time, when the country woke up to the realization that it has always been health and health, many things socially and culturally were just damaged. So I guess there has to be, in one way or the other, a way to reconstruct our understanding of this pandemic, so that social scientists and the social aspect and the cultural aspect are brought in, so that people understand it's not about you covering your mouth only. It's about you knowing how to take care of yourself, of your family, and everyone else, because the social fabric has completely eroded here in Botswana. We have never known Botswana to be number one in terms of violence. And ever since this pandemic, it's not only violence, killings. Gender-based violence is high. Almost every month there's someone has killed a boyfriend, has killed a girlfriend, because again, the issue of you not now being able to support your family, those are everything was really forgotten, and it was all about the health issues and the social sciences. Like I said, they were completely forgotten. We really need to find a basis, a ground whereby we can say, how do we as a society reconstruct and come up with a clear understanding, a societal understanding of the pandemic, so that we don't leave anything behind. Because even issues of those people who were sick and who were suffering from other diseases were completely forgotten. Imagine people who are in detention, imagine people who are disabled, imagine women themselves who could not even go out. They used to do piece job, but they cannot do all the piece job. And everything was just centered on the medical aspect of it, and everyone was forgotten. So really, I think here in Botswana, people are sick. As we're saying, I can use the word sick. I don't know what is it that is going to take the society back to where we know it, to the Ubuntu that we are saying, or Ubuntu that we used to have. Because those fabric, the societal fabric, they have actually been eroded seriously because of our focus only on the health aspect of it, and forgetting that it's not only health. Health comes together with all these other things to make the pandemic a little bit better known, and so that it can be addressed. So I wouldn't say that the community have been appropriately served, but I will say from the beginning, there was that confusion. No one knew what it is. So we were borrowing just like every other person was borrowing. And it really took, like I say, a lot. And here in Botswana, really the response to it was just high. People were contributing, some even contributing $1 to this. And there was a lot. Everyone wanted to contribute, but everyone was contributing towards the health part of it, forgetting that there are other issues that should be attended to. So I think that is, like I'm saying, more moving towards the reconstruction of understanding from the societal perspective what this pandemic is, and how it can affect the society, and how it can be addressed effectively, so that other things are not left behind and they suffer.
Thank you. Thank you, Rebecca. So it's compelling, it's harrowing, as are some of the comments and questions coming in the chat. I'm just going to ask for one more response about this. Deepa, I'm just going to put you on the spot one more time to bring in, as if we need any more motivation, just another layer. Rebecca talked about the borrowing, referring to borrowing initiatives and policies, and many of our panelists have talked about the lack of relevance and specificity of these initiatives. And Deepa earlier today spoke to me about the potential debt trap and debt crisis. And I wonder if you could just, although we don't have any economists on our panel, I wonder if you could just introduce and point to that aspect that's also emerging.
Okay. Well, with the pandemic, we saw that trade was really affected. So countries like in Africa that were trading, that were exporting to Europe and the US, they couldn't do that anymore. And that, I think that's where we need to really rethink how our economies are being run. And then the predictions that, 3 years, it will take 3 years, 5 years, it will take several years for the economy to recover. So you'd find countries borrowing a lot of international finance. So that, what will be the long-term implications on that? I'm not an expert to talk on that. So, but I'm just throwing the question that we really have to think about that. In Eswatini, we set up a committee specifically to look at bringing in finance, but without, not as debt, but as climate finance. Because the root of this, the cause of the pandemic is basically from human-wildlife interactions, the loss of habitats, and that's how this wildlife has come into contact with humans and caused this pandemic. So that we are forgetting in the middle of all this health and gender and all the other community issues, we are forgetting that the root cause of the pandemic is because we are not taking care of nature. We have been abusing nature for far too long, and now nature has given us a shock. So we really need to look at that. And if you remember, just before the pandemic, the whole globe was talking about climate emergency. The Greta Thunberg, children's strikes, school strikes on climate, the extinction revolution. There's a lot of things were going on. A lot of attention was going on climate. And with climate change, we can expect more pandemics to come in the future. So there is really need for countries to utilize climate finance and make our environment more resilient and our countries more resilient. So Eswatini had set up a committee specifically on that to look at how to bring in more climate finance, which is actually a more sustainable way than perhaps borrowing a lot of money, which you'll end up having to pay back. So that brings me back to the Ubuntu point. We need to now move from when we, just the Ubuntu where we are looking after each other as humans, but to eco-Ubuntu, where we go beyond humans to plants and animals and protecting the entire globe, the entire environment, because that is what will sustain our lives. So that is also a rude awakening and something that we can learn from the pandemic.
Thank you, Deepa. So I'm going to draw on a couple of the questions that have come into the chat in our last few minutes. But before I do so, Alistair, would you be able to show us the results of the poll questions? I don't know how you're going to do that, but you will show us. Here we go. So the first question was asking the attendees today what you think is the biggest threat caused by the pandemic. And so can everybody see this, or is it just me?
We can see it, Mia.
Okay, great.
We can see it as well. Yeah.
I don't have to read it out. But we have obviously a large percentage that looked at health, but also many people looking at incomes and economies, which might take us on to some of the questions that have been coming in. And who do we think are the most threatened? So in this particular, maybe not surprising, in this particular context, we have a predominance of perspectives around people in resource poor contexts. So I'm going to draw on a couple of questions but please feel free to keep adding them. If we can't answer them all as a panel in the next few minutes, we can certainly respond to them in our Interactive Voices Hub website, where hopefully some of these conversations will continue. I would like to ask the panel, we've had lots of questions around the relationship in productivity, in consumption and trade between individual contexts and cross-border and international contexts. So I'm wondering if anybody could respond, if anyone has a perspective yet on how the pandemic has impacted positively or negatively on productivity and consumption and the nature of consumption, whether it's local or sustainable consumption or problematic or unsustainable consumption and productivity in your context. So I'm sort of trying to draw together a couple of questions. One person was particularly interested in about local initiatives around farming and agriculture, food production, but others are interested in about the barriers to trade, necessary trade sometimes across borders. So can anyone speak to the impact in relation to the sustainability or the nature of productivity and consumption that has emerged because of the pandemic? And I'm going to ask you just to unmute yourself and speak up.
Okay, can I just say a few there? But before moving to answer this question, I just wanted to add to what Deepa has said, to what Deepa said. Apart from the climate Resource Mobilization Committee, there was a National Resource Mobilization Committee that was set up by the government to mobilize the resources. And indeed, more than half of the response fund was actually raised from contributions by local companies, by people, plus by development partners. But even with that in place, Eswatini has increased its debt to really unsustainable levels. Even as we speak, there's a serious debate in Parliament to say, how long are we going to be borrowing to be able to meet the needs? Obviously, Eswatini, the pandemic came and found Eswatini in a very precarious situation as far as resources are concerned. So the impact has been it's gravest in terms of the economy of the country, not only at the national level but also even at individual level. Now coming to the impact, of the pandemic on production and consumption, it has been, I would say, mostly positive for the country, because it has really, raised the concern and, awoken most of us to say we cannot, in Eswatini, we cannot be dependent to South Africa for everything, and stimulated local production. And we had a lot of, instructions we need to produce locally, and it was a buzz on social media that we depend too much on South Africa for almost everything. And so that has been positive, and even the government is taking steps, towards ensuring that, we are self-sustaining, particularly in the basic, commodities, including, vegetables and cereals. Now, the negative part was from the materials that we needed, for the response, because South Africa closed their borders completely. Even items that we had actually procured, were delayed to come into the country because they had to be, they couldn't be allowed in through the borders, because, all countries took this, to say you cannot export this particular item because we need it, in the country. So even what we had procured was actually locked on borders. So we had items sitting at the borders on the other side, 3, 4, 5, 6 weeks sitting there until the government began to negotiate for certain items, to be brought into the country. And also some of the items had to be airlifted, from Taiwan and from other countries into the country, because our major, country, our major neighbor from which we import stuff had locked their borders. So this is how our country was impacted.
Thank you, Russell. And we're going to hear from one more perspective. I think we've got time to hear from Uganda in response to the same question. Dr. Vincent Morenika.
Uganda is a fairly unique country because I think, as we always say, we are a gifted country. We have rich soils. And as far as food is concerned, I thought food during that time would be very, very expensive and that people would not afford to buy food. Surprisingly, there was a lot of food. So cheap food was very, very, very cheap during that epidemic. That was very, very surprising because then Uganda is not a net importer of food. For many of the food items, Uganda produces their own food that we consume. So that time, we were not exporting, but were simply consuming our food. So people were had enough food on their plates. And then it gave the country an opportunity to look inside and say, we have been importing a lot of things, including very small things that we need in our households. But now that the country has been cut off from the outside world, we need, therefore, to look inside and promote our own resources. So the masks that people are putting on, we are now produced locally. Actually, there were even courtyard industries producing these kind of things. So in that way, I think in a way, it improved the country's self-reliance in terms of industry, at least at some point, not so far, but at least the basic things. Uganda can now produce very, very small things that it used to import before the pandemic. So that is what I would say about what was happening in Uganda.
Thank you, Vincent. That's really encouraging. Okay, I'm going to squeak in one more question, and then we're going to move to a video that we have, a little video that we've put together about the project. And the last question that I can squeak in today is a question that's been waiting to be answered for some time, around the question of again, I hope positively, but possibly negatively as well, volunteerism. And if you see in your contexts a surge, an increase, or a lack of communities' willingness to come together to volunteer. And some of you have touched on it already, have had quite different experiences of this. I think in Botswana, perhaps it's been quite different. But if anyone wants to add any specific examples or responses to a question that's come from our audience around what have you seen happening about communities' willingness to volunteer in response to some of these urgencies that have arisen. And again, I'm just going to ask you to unmute yourself if you have a response or an example.
May I wanted to comment on something.
There was a solution to that at the beginning. Rebecca, would anyone else like to comment?
I think it's okay now.
There you go. Yep.
No. Here's the volume.
Would anyone else like to comment while Rebecca's sorting out her echo?
Okay.
You want to try again, Rebecca?
I'm not sure if it is okay. Can I still come in?
It's not so bad. Let's see. Let's see if we can. It's not so bad. Why don't you try?
Can you hear me?
Yes.
Okay. Sorry, I wanted to comment on the earlier question. Just to give just one example of something that I thought Botswana did very well in terms of issues after realizing that depending on cross-border food can happen to us. And because of the small population in the country, The president has actually put in place what he calls presidential small stock projects, whereby he's able to go around the country and donate some small stock for free, so that Botswana can actually be self-reliant, especially in agriculture. Then in addition to that, he has actually established market in Europe for the small stock to be sold, because Botswana has been relying on South Africa for so many things. And this pandemic has actually shown Botswana that reliance on South Africa can be a problem, because of during the time there were some strikes in South Africa. So at times we will go for weeks without petrol because of those strikes. So I just wanted to talk about that, although there are so many projects that I can talk about, that the one that is doing very well right now is the Presidential Small Stock Project, where everyone, most of the farmers, almost all farmers are getting some small stock free. And then the market is already there for them to go and sell them. The other issue perhaps that I should not forget is the issue of access to water. Rural areas, they haven't been having water, but because of the wash your hands slogan, the government made it a point that each and every household should have a standpipe at least to wash water. So there are many things, but those things, I think for me, they stand up to be very good projects that actually show that even those people who have been deprived, they can be catered for if the government wants to cater for, because this pandemic has actually shown that everyone can get water in Botswana when we did not get water, and that we can actually achieve food security in Botswana. We have farms that have not been used, and now they are being used right now. So I wanted to say those 2 points before moving to the other one. Thank you.
Thank you, Rebecca. Okay, so it feels like we could go into many different areas here, but with a few minutes left, I'm going to do 2 things before I hand back over to Alistair to show us.
I'm not being heard.
And one of them is to say that Professor Ajayi has just joined us.
Just a minute ago.
Can you, Shola, welcome to this session. I think maybe you have heard everything. There you are.
Sorry.
So you have 3 minutes left, and I'm going to give you your option. Which question? So Shola is coming from the context of Nigeria. I'm going to give you your option whether you would like to respond to the most recent question, which was examples of positive examples of people volunteering or new initiatives emerging in a positive sense in response to the pandemic. But we have been discussing from our various different contexts some of the key issues beyond the health issue that we're all facing, and that the Whose Crisis Project is moving towards to face. And it's very timely that you've come on board, because no one has mentioned yet, we haven't had a chance to talk about the implications for the agricultural production that might come about as a result in the next 12 months, 24 months as a result of the pandemic. And that's something that I know you can speak to particularly. So in terms of the beyond health issues, perhaps you could mention a little bit about some of the issues you're facing as an agricultural scientist about seed, access to seed, food production, both now, but also next year and the year after.
Thank you very much. Once again, my apologies for joining late. Let me say that in the Nigerian context, attention was given to cities in terms of containing the pandemic. In fact, there was a specific directive from government that farmers were not affected, and that people living in the rural areas were actually encouraged not to obey the lock-in or the lockdown rules, that they should continue to go to their farms. But then they were also cut off from supplies in terms of inputs for food production. So on the one hand, there was almost no attention to rural communities. And I'm emphasizing that because for those of us who are working in this kind of project, our attention are on these communities. Even though they were already marginalized from government services, they were further marginalized in terms of attention during the COVID. Unfortunately, government was relying on them, and there were a lot of publicity that were given that they shouldn't stop going to farms, they shouldn't stop food production, more so that also agricultural logistic supplies were exempted. Anyone carrying food supplies, irrespective of the lockdown or the situation in any place, they were allowed to move freely. But what we then had is an issue where even though farmers were allowed to go to farms to produce, they did not have access to inputs, seeds, fertilizers on the one hand. On the other hand, they also did not have access to health services, because majority of those who are providing health services were not usually resident within those communities. And because of all these issues, you also have a coalition of the private sector providing what they call palliative. Unfortunately, because of the distribution challenges, you then saw that when we had this End SARS protest, some of us had it up to 2 weeks ago that people were vandalizing and breaking into these stores. People got to know that there were foods that were stored, and they broke into those stores to cut away those food that were meant to be distributed. So we have issues that marginalized, neglected communities were further neglected as a result of the COVID, with a lot of the attention on cities, but at the same time, they were requested to ensure that the flow of food production activities were not interrupted. So to a large extent, there wasn't any much disruption in terms of their own daily activities going in and out, but there were limitations and restrictions in terms of services that they could access. And like I posted something this morning that we also saw that in one of the communities that we were working, in fact, in all the areas that we were working in mining communities, they were reporting a lot of death arising from rape, arising from vandalism, as well as some of this hostage taking, which we had recorded. And I woke up this morning, and as I was reading the paper, that was the first news that jumped at me, that the communities that we were working, including a displacement of the traditional ruler in that community. So that's in a nutshell paints the picture of the situation that we have in Nigeria. It further deepened the mistrust that people in isolated communities in most of the areas where we work on government agencies. Thank you.
Thank you so much, Shola Ajayi. I think this is probably a good time to end, partly because the really difficult questions are coming in now. So both in the Q&A and also in the chat, we are rightfully starting to ask then, what can we do? What can people do to address some of these under-addressed problems and marginalized or silenced issues in many of our communities? And we're not going to answer that right now, but thank you, Alistair is going to save me by putting up the second poll, the last of our two polls. But also I want to acknowledge that the panelists that have come together today are just a small number of a much bigger network that are coming together as part of the Sustainable Futures in Africa network. And Alistair and Vanessa have made a small video to introduce our project and get us started that we're going to show you now. It's a bit of a little bit of a break from this very heavy, harrowing conversation. And we'll, I think, hand over to Alistair, take this video watching break. I think the video is just a few minutes long, and then we will come back to wrap up this session. So take the last poll if you can, and back over to you, Alistair. Whose crisis is this COVID-19 pandemic? Is it mine? Is it ours? Although COVID-19 is a health issue, the crisis is far more than a health crisis. It's a social and cultural one that is currently poorly understood and minimally represented by the vast majority of those suffering from it. Immediate cultural production, critical commentary, and public policy are being showcased and circulated globally. This may prove to be the most documented pandemic in history. But the dominant discourses are generated in the global north by people like me, by a minority of privileged authors reflecting on a crisis that, while impacting the whole world, is experienced in vastly different ways. This project strives towards a rebalance, a glimpse of the plurality of our globe and our experiences of this time. The WHO's Crisis Project is an urgent response to the rapidly evolving global pandemic, whereby the leadership is coming from spaces far removed from the realities of suffering and change that this pandemic is causing. The project is co-curating representations and developing understandings of the social and the cultural crisis and shifts generated by the COVID-19 pandemic in plural and marginalized communities. The project is exposing unseen and misunderstood aspects of this time.
COVID-19 has made me realize how connected we are as a globe, and that each of us is safe only if all of us are safe. So really we need to look at how to make the world more equitable, more just, and more empathetic.
COVID-19 pandemic came with untold hardship, not just only for the economy, but for the family, for the youth especially, those that depend on making money on a daily basis to get by.
Religious people, members of churches, going to their pastors to beg for food.
For instance, our neighbors came to our house asking that, oh, please, can we help out whatever it is that we can give to them? Whatever food, whatever amount of money we could give to them just for them to survive.
So it has turned many people to become beggars. It has turned people to become, let me say, helpless. And there are many terrible things, many shenanigans that people are committing because of this terrible pandemic.
The number of girls who've ended up getting pregnant when they were out of school. We're hearing about increases in violence against women and girls, increased mental health challenges.
The COVID-19 pandemic has caused unprecedented economic impacts for both business owners as well as the working class in Malawi.
The secondary impacts of COVID in Malawi have been huge. The economic impact, particularly on sectors like tourism, where loads and loads of people are out of work.
They had to, some of them had to ask those of us that had supplementary income or a steady source of income to be able to survive the gripping part of COVID-19 pandemic, especially during the lockdown.
Important and relevant events and functions have been cancelled in order to protect one another from the virus.
Previously, it was medics who were known for face masks, but today it is for everyone as a preventive measure towards coronavirus infection. However, schools and institutions were closed down, as well as churches.
We have a situation on our hands caused by COVID-19. The means of protection include at every entry point temperature check, sanitization, and mask wearing. Indeed, the new culture of COVID-19, a crisis.
The reality of a human race living a normal life and that a large group of people can be gathered and celebrate during their social and cultural functions like dances and traditional ceremonies, this reality has been diverted as COVID-19 pandemic has negatively affected our lives.
What concerns me is that I really can't quite visualize what the end of this crisis actually looks like. But this crisis has also brought a lived experience to the staff and students at universities, affording us the opportunities to reimagine career pathways with much greater relevance to the real world.
And I miss that human connection, the social connections, but it has taught me a lot of lessons and made me think deeper about life.
Irúfẹ́ rí ìdojúkọ ńlá ìṣẹ̀lẹ̀ má lè gbàgbé tó kọ́ wa wípé ìlera ẹnìkan ìlera gbogbo wa ni àìlera ẹnìkan pẹ̀lú àìlera gbogbo wa ni. Ó sì kọ́ wa wípé gbogbo wa a nílò láti ṣera wa ní òṣìṣẹ́ ọwọ̀ fún àǹfààní ayé.
I just wanted to say thank you to everyone who took part in that, everyone who made a contribution to that video. Just in a short personal sort of circumstance, I just wanted to say it's been the honour of my life to be able to support this kind of network and everything that their accomplishment. On behalf of the network, I look forward not only to kind of curating this, but also to learn from this project. And that's hugely important to me and to the organisation that I represent. But I also want to learn and be inspired by everything that you do. The creation of this website very much is designed to get people involved, to connect, to learn, and to amplify these voices. And I hope this video serves to contribute to that. And with that, I'll pass over to Mia, who can wrap us up, I believe.
Thank you, Alistair. Thank you. Yeah, thank you for this amazing and very quick work and all of the work from the team that has gone into it. So what remains for me to say is that we're just launching, about to jump into this project that will take us forward into the next year, but beyond, no doubt. Our focus to answer some of the questions that started emerging, what are you going to do about it? What are we going to do about it? Our focus is on working with communities in culturally responsive ways, looking at culturally and arts-informed methods to learn about these issues on the terms of those communities that are currently underheard in our contexts of governance and economies and policies and activism. So we're looking at drawing on our vast expertise across our network at working in arts-based and participatory methods with communities, moving forward into fieldwork and the curation of these stories and experiences and solutions and perspectives, a lot of which you'll see through the new website that was just launched today, but also in other forums, including through media and hopefully policy influence. So my request to everybody watching today is please get in touch with us and help us to amplify the voices and the issues as much as we possibly can, and we can only do that through an ever-increasing network. So please get in touch with us to share your ideas, share your connections, share your questions. We're going to try and maintain a very interactive website with active forums at all times, and we're always keen to connect with you. Thank you for being here today. This has been a great boost for us, a great motivation to get these things started. And then most of all, thank you to the panelists who've come together. The session is recorded, as you can see, so we're going to be able to continue to learn from the responses today, but also the questions and the expressions of interest and the additional layers of context that have come in through the chat. So thank you so much, everybody. Please take care and keep in touch.
Thank you, Mia.
Thank you, bye.
Thank you.
Bye.
Vanessa, could you put the website link in one more time for anybody who lingers into the chat? Thank you.